What is atrial fibrillation? Atrial fibrillation is a type of arrhythmia or irregular heartbeat that is the most common arrhythmia in the United States. So normally our heart beats, 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 top chamber, bottom chamber. In atrial fibrillation, there's an erratic type of electricity formed in the top chambers of the heart, which causes the top chambers, instead of beating synchronously like this, to shake or fibrillate and beat erratically. Now, what happens because of that? Number one, heart rates can tend to be pretty elevated in atrial fibrillation, not all of the time, but they can be, and that causes a very uncomfortable feeling for patients. Also, it beats erratically, so instead of beating nice and straightforward like this, it beats on and off, so it's a very, very irregular heartbeat. Now, when you take blood and you shake it up, or when you have atrial fibrillation and it's shaking in the top chamber of the heart, that can cause blood clots to form inside of the heart. That's bad. If those blood clots then form and leave the heart, they can cause a stroke. So our job as cardiologists is multifactorial. It's number one, to make sure the heart rate is controlled. Number two, to risk stratify which patients are at higher risk of having blood clots and then treat them accordingly. And then we decide if we should get them out of that arrhythmia, and there's various mechanisms of doing that, or let them stay in the arrhythmia if it doesn't bother them with possibly blood thinner medications and keeping the heart rates low. There's multiple reasons why we do this for different patients, and it's very much patient dependent. Not everyone needs an ablation. Not everyone needs medicine.